The most important step in an IVF is embryo transfer. In this video, myself, Dr. Sneha, fertility consultant and gynaecologist, will be discussing the difference between fresh and frozen embryo transfer. Normally, during the procedure of an IVF cycle, especially in the initial days of IVF, it used to most of the time be a fresh embryo transfer on day 3. That is, give injections, grow the eggs, retrieve the eggs, take the eggs from the ovary and fertilize it with a sperm, make embryos, grow it for 3 days and put it back into the uterus. However, with evolving of understanding of how the ovary operates, how the embryos grow and how the hormones work, nowadays we lean more towards frozen embryo transfer. Why is it so? During fresh embryo transfer, first of all, there may be an imbalance of hormones. That is, when more eggs are produced, there may be more estrogen. Because of this, the lining of the uterus may not be very receptive. So if we transfer, the chances may be lower, or sometimes if we have got more eggs with a very high estrogen, with a fresh embryo transfer, there are chances of something called ovarian hyperstimulation, where the fluid fills up in the abdomen and it may become a problem if she gets pregnant. The other problems which may happen is sometimes when we get good eggs, the uterus lining may not come very well. We don't get the typical thickness of the endometrium we need, or the pattern of the uterine lining that we need. So all this we can combat with the use of frozen embryo transfer. With the advances in technology, with the advance in the way we understand the embryo, in the way it is frozen, and the embryologist experience increasing and the laboratory culture conditions increasing, we are leaning more towards frozen embryo transfer because we expect a better success rate with frozen embryo transfer. First of all, the hormones can be normalized. We can plan when we want to do the embryo transfer, and we can plan how the hormones should be within the cycle during the embryo transfer. And in this way, in frozen embryo transfer, the IVF is divided into 2 separate stages. In the first stage, which concentrates on egg retrieval and getting a good number of good quality embryos. In the second stage, we concentrate on getting good frozen thawed embryos. That is, once we freeze the embryos in the first cycle, we take it out in the next cycle and we ensure that they have survived this process, and then we transfer it. So it is like a stress on the embryos, and if they are good quality embryos, they survive this process of freezing and thawing. So we expect better chances of success with the frozen embryo transfer.